Saving a pregnant who has COVID-19 and also has spinal anesthetic toxicity after a C-section. On August 22nd, Da Nang Hospital said that their doctor had just saved the pregnant and TT, 23 years old, living in Quảng Nam province, had COVID-19 and anesthetic toxicity after a C-section. Using ECMO technique, full cardiopulmonary support. Accordingly, patient T was primigravida at 38 weeks gestation, lacking amniotic fluid, and had a C-section by a lower-level hospital. After 6 hours of surgery, the patient was in a critical condition. Blood pressure dropped, consciousness was agitated, and respiratory failure. She was transferred to the emergency room of Da Nang Hospital immediately. At Da Nang Hospital, the patient was diagnosed and monitored for spinal anesthetic toxicity after C-section on day 1 with severe COVID-19 infection, acute cardiopulmonary damage, acute respiratory failure, and circulatory collapse. Immediately, the patient was transferred to the isolation room of the Department of Tropical Medicine and was intubated, mechanically ventilated, and intensively resuscitated. Master Dr. Trương Thị Hoa, Deputy Department of Tropical Medicine, Da Nang Hospital, said that because of anesthetic toxicity, the patient's heart was very seriously damaged. The diffuse lung damage on both sides was severe, not enough for gas exchange. The medical treatment did not respond. So, the team of the Department of Tropical Medicine consulted with the intensive care unit to apply ECMO techniques right at the Faculty of Tropical Medicine to save the patient's life. During ECMO, the patient was monitored, intensively resuscitated, mechanically ventilated, and administered high-dose vasopressor. After 5 days, the patient's cardiopulmonary index gradually was recovered, weaned off ECMO, and continued to be treated according to the severe COVID-19 regimen. After nearly 15 days of treatment, patient T was completely got off the ventilator, had good contact, was negative for COVID-19, and was discharged. Master Dr. Nguyễn Tấn Hùng, Deputy Head of the Department of Intensive Care, Da Nang Hospital, said that this was a very complicated and heavy case. Patient T had up to 3 severe problems at the same time. Patient who had just had a C-section was at risk of severe coagulopathy, could cause bleeding. Besides, the patient has both cardiopulmonary damage due to spinal anesthetic toxicity and severe lung damage due to COVID-19 infection. So, the prognosis for death is very high. Doctors have combined many techniques such as ECMO, maximum mechanical ventilation, using high-dose vasopressor to save the patient's life. This is really a blessing for the patient to receive timely care and treatment in the play, with a team of experienced intensive care specialists combined with good and modern equipment, said Dr. Hong.